The history and practices of hypnosis and its mystical spiritual journey, which spans over 4,000 years, is slowly becoming recognized by the psychology, medical, and scientific worlds as a modern-day therapeutic tool. Hello, I'm John Barboza from Life Enriching Hypnosis, and you are listening to Hypnotism 101. Thanks for tuning in. Over 4,000 years ago, hypnosis was practiced in Egypt, Greece, and India. Sleep temples were places sick people would go in order to be healed of their ailments. Chants and rituals would be used by doctors and priests to induce a trance state, and suggestions would be given to restore them back to health. In the 18th century, German physician Franz Anton Mesmer introduced the world to animal magnetism. He suggested that the body contained a natural force that could easily be manipulated with magnetic devices that were passed over the body to unblock this force that was causing the illness, thus healing the person of his or her sickness. This mystical practice was known as mesmerism, and his followers or believers were known as mesmerists or magnetizers. The skeptical non-believers debunked this practice, but there was an interest in the psychological aspects of this method that remained. In the 19th century, a Scottish eye surgeon named James Braid was fascinated with this psychological phenomenon. While in his office, he briefly left the room having his patient focus on the light above while he was away. When he returned, to his surprise, he noticed that his patient was in a trance-like sleep state. He wrote a book about this state and coined the phrase hypnosis. In Greek mythology, Hypnos is the Greek god of sleep, master of dreams. After some time, Braid realized that he should have called this state monoideism, mono meaning one and ideism meaning idea. When you put your attention on one idea, you enter a trance-like state, which is focused attention and relaxation, not sleep. Sigmund Freud used hypnosis, but later focused his attention more on therapeutic applications like psychoanalysis. And a French physician named Jean-Martin Charcot used hypnosis in treating hysteria and mental illnesses. French psychologist and pharmacist Émile Coué focused on self-help with the use of autosuggestion, where a person repeats affirmations and visualizes these suggestions while in a relaxed and focused state. Milton Erickson, an American psychiatrist and psychotherapist, used indirect suggestions by means of metaphors, hypnotic language, and storytelling to help his patients. James Esdale was a surgeon who used hypnosis to place people in a deep state, sometimes called a hypnotic coma, where they would remain unresponsive to pain while being surgically operated on. This is known as the Esdale state, which was coined by hypnotist Dave Ellman. The hypnotic altered state of consciousness is so deep that physical healing is accelerated and spiritual deep emotional changes have been experienced. Dave Ellman, a hypnosis pioneer, taught hypnosis to people in the medical professions such as doctors and dentists. He created a 3-minute rapid technique to hypnotize people known as the Ellman induction. He helped remove the stigma of hypnosis from the old vaudeville shows to a more professional field where training courses and lessons known as medical relaxation was taught. Today, science and medical professions are studying the efficacy of hypnosis, realizing its unique therapeutic benefits in the healthcare field, where pain management, anxiety, depression, sleep disorders, and many other issues are continually being explored. I'm John Barboza, and this is Hypnotism 101.